Canada's healthcare system is at a breaking point. Nurses, doctors, personal support workers have worked under the grueling pressures of COVID-19, managing new waves and long shifts while doing their best to stay safe under layers of uncomfortable PPE.
Granting Civic had called the code orange. My heart broke. My heart broke really hard because I know what that means. That is a disaster. A code orange is called because of a nursing shortage.
But all that has taken its toll, and now healthcare workers are burnt out.
Outside of our work, we've given a lot during this pandemic. We have given everything we got. A lot of us got sick. A lot of us are burnt out. You can't ask us to hold the weight of the world on our shoulders anymore.
Will they recover? Politicians don't deny the pressure those on the front lines have felt.
This pandemic stretched our system to the limit.
Our healthcare system is dealing with 2 public health emergencies and lots of demand.
This is a very serious pressure on the system.
But is it too late? What does a shortage in doctors and nurses mean for Canadians, and how will it impact the future of healthcare? This week on Context, healthcare burnout. Welcome to Context. I'm Maggie John. What has it been like working on the front lines of healthcare during the pandemic? Dr. Jean Chamberlain-Froese is a physician and founder of Save the Mothers, an organization fighting maternal mortality. She has a new book, Our Long Midnight, where she reflects on life and faith during a global pandemic. Dr. Jean Chamberlain-Froese, thank you so much for joining us today on Context.
For sure, lovely.
Why write this book?
Well, I think I just wanted to remember some of the things that I was going through myself, but then also to offer hope to others as well, too. How do we go through these long midnights? And, you just don't really know when the midnight's going to end. And how do we walk through it together and have that hope? And as a believer, one who loves Christ, just even in the context of, being in difficult situations in the hospitals with mothers who are almost dying of COVID, how can you have hope and offer hope to others as well?
It's kind of like an intimate look into just what it's like to be a physician on the front lines. Was that hard? Was it hard kind of documenting that and allowing people into some of those stories?
Yeah, I think you just have to be really careful about sort of the sensitivity of not being able to identify a patient unless you had obviously asked their permission before. But I also wanted to sort of reflect on my own personal life as well, too, because I think when we sort of separate our professional lives and then our family lives, things were happening in my family life as they were for everybody else as well, too. And that obviously interacted with my professional life as well, too. When I went to work and I was worried about my parents, that was still in my mind as I was there. So, and yet at the same time, you're walking into a situation where there's, a spouse, a partner who's very concerned about their wife or partner who's, potentially dying of COVID while pregnant. How do you somehow not forget, or at least put to the side your own issues and walk with them during that, and really to be able to offer real empathy and love in that situation as well, too, and hope and peace. I think that's the thing, is it's really the peace factor. I think it was so important during those really difficult times, and may continue to be as we move forward.
Yeah. You heard so many stories, especially in the early days, and that's really what your book captures, is the earlier part of the pandemic, where doctors were almost kind of forced into this other area of really also being a support network for some patients, because visitors weren't allowed in.
Right.
People weren't allowed in to support their loved ones. And you tell the story of Vera, this woman that you kind of came alongside and helped. Tell us that story.
Well, I remember as on call, she had come through the emergency department and was quite ill, so she needed to be admitted. She was over 90, and we thought she was going to need surgery. So, of course, if somebody needs surgery, they can't have anything to eat or drink. And so she was up on the ward, and I had gone to see her in the morning along with the resident doctors. And, she was looking slightly better, so we were hopeful that maybe she wouldn't need surgery. We weren't totally sure. But she was so lonely. She couldn't speak English. Here's this over 90-year-old woman. And so I wanted to make sure that we could communicate with her and also with her loved ones about sort of what was happening. So I had my phone with me. Of course, she's over 90. She doesn't have her own phone. There's no phones in the hospital at that point that we're working. So we phoned up her son, and I totally expected that, her son would sort of be some young fellow. I mean, he was in his 70s, and his wife had some terminal illness, and he was quite shaken already. And, it was just it was such a special time to listen to him talk to her, because he hadn't heard from her in a while. And I mean, if any of us, and myself personally, have had the experience of having someone in hospital when you can't communicate with that person, it's really upsetting. So it was just a neat experience to be there with him and to, be part of that so that she at least felt better. But then when we finally decided, well, she doesn't need surgery, well, then that means she could eat and drink. And, again, things were a little bit tough with the cafeteria at times and stuff like that. And I just knew she wanted her coffee. So I needed a coffee myself. So I went down to Tim Hortons. That's one thing that we haven't closed at the hospital was Tim Hortons. And just brought her up a coffee. And, did you see the bright lights in her eyes when I walked through with these coffees? I'm sure the nurses were kind of like, what's this doctor doing? Yeah. But anyways, I mean, I think that kind of therapy can be so helpful for people, and it takes thinking outside of the box of what my requirements are as a healthcare worker, whether you're a doctor, nurse, physio, whoever you are, nutritionist. How do you do that yet maintain the professionalism that you need to do as well too?
The humanity of it all, the humanity. And then there's this other story of little Hosanna, who, her mom was not able to be with her. She's in the NICU, a little brand new baby, and how you were able to extend and be that connecting point for this brand new baby into this really weird world. And her mom, tell us that story.
Yeah, well, the mom had come in preterm labor and had COVID, and so she delivered the baby, but then when the mom got discharged, she couldn't stay in the hospital. She couldn't come in to visit because she's COVID positive. I mean, that's a sharp turn at the door right away. And so I would go into the NICU, and I knew this couple actually through my church. And so I would go in with my little FaceTime, and I'd FaceTime in with the parents, and they could see the baby. And obviously the NICU nurses were doing that already anyways. But I think when it's a friend of yours, okay, I'm a physician, but I'm also a friend of theirs. It was really a neat experience. And it's neat how it creates that kind of bond between you and that individual as well too, and in this case the parents.
Yeah, well, we're going to continue with Dr. Jean in just a few moments, but first let's hear from one nurse who has been on the front lines since the beginning of the pandemic and has reached her breaking point. Heidi Barrett is a registered nurse working in the ICU at Mount Sinai Hospital in Toronto, and she joins me now. Thanks for joining me today, Heidi.
Thank you for having me.
It's
my pleasure.
Yeah, thank you. Thanks for being here. What have the last 2 years been like for you as a nurse on the front lines?
They have been extremely challenging, to say the least. And nothing like I've experienced before. I started my career about 20 years ago when SARS first hit, and that was quite terrifying. Going into this one, I couldn't believe it was happening again. And just seeing what was on the news around the world in Italy and New York, we were bracing and we were terrified. So it's been a real roller coaster ride, to say the least. It's been very challenging.
Yeah, I want to hear more about that. Many frontline workers were called heroes at the beginning of the pandemic. Are you still treated like this now post-COVID? And explain to me what those challenges are like then.
We didn't feel like heroes. We felt like we were very much sacrificial, to say the least. Like, we felt like your heroes, go do that job, but it kind of felt like an empty thing. Like, I know people meant well, but it felt like, I don't know, like we weren't feeling very supported, even though people meant well. It did feel like a little bit like we were like almost like the sacrificial lambs. It's hard to explain, but it felt that way.
Paint a picture then for me, Heidi, of what some of the frustrations you're experiencing are and why you feel like a sacrificial lamb.
So first of all, there was fear at the beginning. And then, well, our work tried to support us as much as they could. They said, we're going to do everything we can. We're going to, open more beds and make sure all hands are on deck and staffing. But as time went on, it was quite exhausting and grueling. Going in and wearing the PPE equipment for 12 hours. We had extremely higher patient load than before, and going in and day out, dealing with patient loss at a higher level, nurse burnout. We lost a lot of staff due to various reasons. People left because of like retirement and going to different areas, just burnt out, so they just left. We ended up getting a lot of new stuff in at the time, and it was very difficult trying to manage a very sick patient, a COVID patient, something we haven't really dealt with before, so we didn't really know what we were dealing with at the time. But wearing the PPE, the N95 mask with a shield over it, with a gown, it was exhausting. Every day you felt like people are saying nice things, like you're doing a good job and you're heroes, but what we felt like was, we're exhausted.
Yeah.
We need help. It was very difficult, and a lot of people are burnt out. They're tired, or they've left already. So yeah.
What
Yeah.
is the solution then, Heidi? I mean, you're still on your job. I know that there is this mass exodus of
hanging on.
nurses. Yeah.
Yeah, like this is my career. I have children to raise. I have a home. I have to work. I've dedicated my life to this job. Solution is more support, more recognition from the government. When they talk about this Bill 124 and they talk about other government employees, jurisdictions, police, firefighters getting these raises, of course they deserve those raises. They all work very hard, and my hat's off to them. But we deserve it too. We are the ones that, honestly, as much fear as the general public had about COVID, we were in the face of it. We saw it. We lived it.
Heidi, on behalf of the many Canadians watching this show, thank you. Thank you for how much you have given sacrificially to this cause from the beginning. And I'm sorry that you haven't heard that from our elected officials. I pray that you will one day, but know that there are many, millions of us who are thanking you and your coworkers for being on the front lines. Thank you for being on the show today.
Oh, you're welcome. Okay, thank you very much for having me. Thanks.
Take care. We're back with Dr. Jean Chamberlain-Froese discussing her new book, Our Long Midnight Reflections on Life and Faith During a Global Pandemic. Dr. Jean, we just heard from a nurse who is just at her wit's end, like many nurses on the front lines facing burnout. What have you been seeing?
Well, you certainly see that burnout. I mean, it's hard to be working these long, long hours and actually just seeing death. I think in our North American culture, people are not used to seeing patients die. I've worked overseas for 17 years and, death there is a little bit more accepted. You go into the hospital and you may die. As a health worker, you're going to deal with people that are dying. Versus here, we're able to save people much more easily. And you also have seen this idea of having to, who are we going to give the resources to? If we only have so many ventilators, who are we going to? So those kinds of questions, as healthcare workers, we're not used to doing that. It's sort of like the equipment's here, there's a skill, here's a problem, I'm going to deal with it.
Right.
And so all of a sudden, when you're tying my hands and saying, help that patient, but oh, sorry, by the way, we don't have. Again, in other places around the world, people are a little bit more used to that. So I think that emotionally has been a great challenge for people. And at the end of the day, everybody has just been really stretched. So I think you are seeing that kind of burnout. You've seen a lot of people also getting shifted to other jobs. I just had a patient I was talking to today that had been in one floor. Now she was, put onto another because of COVID. So those kinds of maybe forced changes are not necessarily always welcome. So I think you are going to see nurses nurses and healthcare workers in general all across the board that, are just going to be too tired to get back in. And you know what, in some ways, I think if somebody's had a serious burnout, the best thing you can do is take some time away. Because it's not good for you, and I can tell you it's not good for your patients either, the people that you're working with, because for them, you want to give them the best care you can, and you just can't. So we're going to see that. So I think the real solution, Maggie, is how do we ramp up the training? And you certainly see a lot with PSWs being trained and a lot higher volumes now, which is good. Again, I always am a bit concerned about the quality of the training. Very important that people actually know what they're doing. So the quality is one thing. And I work at McMaster University. I direct the obstetrics and gynecology training for all the medical students coming through, regardless of what they're going to do later in life. And, it's a challenge because I can't get the students into the clinics as much as I used to before. Certainly we've had a decent baby boom, so there's lots going on in labor and delivery, but there's more to women's health than just labor and delivery. So these are challenges. Yes, you can do simulations, you can do the Zoom meetings and all that sort of thing, but that person to person, somebody actually being able to go in and talk to a patient who's upset or scared or concerned and be able to, effectively communicate with them, is easily lost if you don't have that kind of hands-on experience. So I think as we look towards how do we deal with burnout, we have to focus on being very intentional about training new healthcare workers. I mean, my daughter is in first year nursing, and I mean, I can see even for her the challenges of, the online learning. Now, thankfully, they're starting to move back into more hands-on, but, her last several years of high school have all been online. And so you have young people who maybe have a hard time actually communicating and dealing with conflict. I mean, with Zoom, you can hit leave, but when you're standing there dealing with a patient that's upset or family that's nervous, you can't just hit leave.
You have a strong faith, Dr. Jean, and you talk about how maybe during this pandemic, God was trying to get our attention and turn us towards Him and seeing Him and hearing Him. What are your thoughts about that?
Well, I think there's been a lot of people who have thought more about God. I think they've thought more about their faith, what's important to us in life. Even in my own personal life, I sort of think, something that I thought was really important before, I'm not sure it's so important now. I mean, my family, my faith, what is it that I'm doing with my life is really becomes front and center instead of sort of all of the other. And yet at the same time, sort of the social media for young people, particularly in all of us, it can take so much of our time and energy. And so we've gone away from seeing people in person and become so focused on electronics that's a challenge as well too. And I think now that we're moving through the pandemic, how do we listen to God's voice? Not the little box in my hand, but how do I listen to God's voice? How do I understand what His will for me and my life is? How do I walk through challenging circumstances? I mean, my own mother right now is very ill. And how do you walk through that? Not looking at, what's happening with her health from my sister or whoever, but actually, important as those things are, don't get me wrong, but at the same time, how do you center yourself in your faith and your hope that, God is in control of all of this? And it certainly seems like chaos. We have other things going on around the world with Ukraine, et cetera. How do you keep centered? And I think I end the book by talking about, the waves, that we just keep going through these waves, and people are telling us we're going to keep going through these waves. But we know the one who calms the waves. And I think if we really believe that, it's not like we won't suffer pain. It's not like we won't have tears, lots of tears. But I think it gives you that stability within the storm.
My last question to you, it's called Our Long Midnight. What does dawn then look like for society, for as we are slowly coming out of this pandemic? What does that look like? What does that sense like for a doctor on the front lines?
Well, I think for everybody, the dawn's going to be a little bit different. And for some people, the dawn's going to be a happy time. For others, I'm not sure it's going to be such a happy time. But as a physician, I think just getting back to the time or the point where the resources are there, where, finally now we're starting to open up operating rooms. I mean, I've literally had patients waiting for surgeries, having terrible symptoms and some of them even cancers, to be able to get them the care that they need. And I think it's socially, that's to me is the bigger issue. Yeah, we can try and deal with the medical issues and try to sort that out and stuff like that, but it's the isolation of people that has become tremendous. And then, again, I look at my own life, and my father has got dementia, and the impact of him not being able to be visited for long periods of time and everything like that, it's had a huge impact. And I'm sure our listeners, there'd be many people who can relate that there's somebody in their life who really has deteriorated significantly because of that. And our youth, you know, do they know how to play together? Do they know how to have community? And that's my prayer is that as we head towards the dawn, that we come together in community. And there's been so much variations on the theme and just challenges with the various recommendations from the government. I totally recognize that, but I think we've got to come together as a community. We have to put away our differences, and we have to come together as a community. And as people who are people of faith, people who love Christ, even more, we need to come together, put our differences aside, put away the past, as Christ has told us to do, and look towards the future for loving and caring other people and showing them the compassion of Christ and the peace that he brings.
Dr. Jean Chamberlain-Froese, please come back.
Okay.
We love having you here. Thank you again.
Thank you.
In our fast-paced world, context is everything to the stories that are shaping us. We want to go beyond the headlines in our new podcast to create space for meaningful conversations, to explore where faith intersects with justice, ethics, culture, and society. We'll be joined by newsmakers, peacemakers, and culture shapers. Join us on all podcast platforms or at contextbeyondtheheadlines.com.
The overload on our healthcare system has been immense. And now, 2 years into the pandemic, healthcare staff are feeling the brunt of it and leaving in droves. The Q panel is here. Colin and Julia, thanks for joining us today.
Hey, Maggie.
Good to be here.
So they were lauded over in the early days and called our heroes. Now they're overworked and underpaid. What happened to the way that we see healthcare workers, Colin?
Well, I mean, a lot of it is fatigue for them, of course. It's been a very long, very hard pandemic. A lot of it is social and cultural fatigue. Everybody's tired about the pandemic generally in all sorts of complicated ways. And so it's much harder to sort of get up the energy to cheer on our healthcare workers, which is unfortunate because this is, hopefully we're near the home stretch here. But even if we're not, we're still deep in for a lot of our healthcare workers. They've got a lot of really hard work to do, and they do, in fact, need that societal support. So it's a tough situation. It'd be nice if we could get that energy back up for them, honestly.
Yeah, and if we've lost energy, they have lost a lot more energy. I mean, again, they've been on the front lines from the very beginning, taking care of us, and sleepless nights, long hours. Julia, what are your thoughts?
Yeah, it's shocking how we went in a matter of months from hanging signs in our windows and banging pots on our doorsteps in the evening to show support for our healthcare heroes. And now they're experiencing this increased verbal and physical abuse. They feel, I think, probably betrayed as people get tired of public health measures and restrictions and start to flout them. And then, of course, rampant misinformation became just one more thing they had to deal with. It's no wonder that burnout is at crisis levels. And I think, as Colin said, over time, people just got tired. We're dealing with our own stresses. And so there was a shift from this wonderful collective sense we had at the start of the pandemic to back where we so often land, which is kind of more self-focused. And I think we need to figure out how do we support our healthcare workers? We owe them better working conditions, safer working environments, and appropriate compensation. It's not enough to just call them heroes. I think those words probably fall pretty flat at this point if we don't make sure that their work and they are valued properly.
Yeah, that's exactly what we heard from Heidi early on. Is she feels like a sacrificial lamb almost in this scenario, and appreciation both financially as well as just support from the government is what many of them are looking for. In a COVID-19 science table, it was found that in spring 2020, the rate of severe burnout was at 30 to 40%, still quite high early on in the pandemic. By the spring 2021, rates were higher than 60%, and that was found in Canadian physicians, nurses, and other healthcare professionals. If nurses are leaving, will our healthcare system survive? Is it time to think about private healthcare? Colin?
Well, I think that there's two pieces here. First of all, the pandemic has demonstrated that our healthcare system is is probably underfunded and understaffed, and it needs more resources. It has come through the crisis, but not nearly as well as we really need it to. I'm not sure. I think that privatizing anything is going to fix that problem personally. One of the issues at hand is, where are staff coming from? Where are we going to restaff all of these positions? Where are we going to increase staff sizes? Privatizing healthcare to a great degree is going to cannibalize the existing public healthcare system, which doesn't actually solve the problem, in my opinion. We need to find instead, I think, new ways to find pipelines for healthcare workers into the system to increase those numbers, actual human resources, where we tout the building of hospitals or healthcare facilities. You got to staff those with somebody. We need more members on that team, and that's really what's going to take the load off. So I'd be a big fan, actually, of putting more money into the public system instead of looking at private options.
You know, we've heard of wait times in Canada being longer than some other countries that have private healthcare systems. And I hear you calling on having more people and more resources in that area. But if we're hearing from those that are on the front line saying, I still don't feel like I'm valued, I wonder, Julia, what are your thoughts on private healthcare?
Well, I think we already have a fair amount of private delivery that happens kind of alongside our public system. Like, I have friends who, you know, facing wait times of a year or more for, say, an MRI or a hip replacement, opted to pay to have those diagnostics or procedures much sooner. And there's two sides to this. So in some sense, it does probably alleviate wait times and the overall burden on the public system, but it also creates some inequity. Those who can pay what are not insignificant fees can access treatments and procedures sooner, but those who can't wait and often suffer. So if we go further down this road, and like Colin, I'm not convinced it's the way to go, we have to figure out how to make sure these private systems don't disrupt access to quality and timely care for everyone, especially those who are vulnerable. How do we incentivize specialists and healthcare workers to stay within a public system when in a lot of ways a private clinic might look a lot more appealing? Our public healthcare system is vital, right? The vast majority of us are entirely reliant on it. And the pandemic, as Colin said, has exposed some real cracks in its foundation. So if there is a move to increase private services, it has to be done in a way that guards and I think prefers the public system.
All right, Julia and Colin, thanks so much for your time today.
Thanks.
Thanks.
There is so much we have learned throughout this pandemic, and the lessons will continue to sharpen our approach to so many things in the future. But the one lesson I sense will be felt for years to come is the importance of seeing and valuing those who have given and continue to give their lives and their time to caring for us when we are sick and cannot help ourselves, selflessly standing on the front lines to serve our society through one of the most difficult chapters of humanity. Now is probably as good of a time as ever to take care of them as well. Thank you for watching. Let us know what you think of today's topic. Join the conversation on Facebook, Instagram, Twitter, and YouTube. For all of us here, I'm Maggie John. See you next time.
Thank you for your ongoing support of Crossroads, a supporter-funded nonprofit organization and member of the Canadian Centre for Christian Charities. Thanks to faithful people like you, we are able to continue producing Context. You can write to Crossroads, P.O. Box 5100, Burlington, Ontario, L7R 4M2, or visit crossroads.ca to learn more about our programs.
Context Beyond the Headlines invites you to an exciting new season. This year, we're expanding our reach with a brand new podcast that will explore the interaction between faith, justice, culture, ethics, and society. As we move forward with this brand new season and the launch of this brand new podcast, would you consider partnering with Context financially? It is because of the generosity of viewers like you that we're able to continue to tell the stories that matter.